Welcome to the Neuroscience Clinic at Stanford. Our goal is to provide you with the best possible care while making sure you have a good experience during your visit. We are a combined clinic of specialists in both neurosurgery and neurology. We are a teaching hospital, so there may be several professionals involved in your care. In this video, we would like to tell you about our clinic and let you know what to expect during your visit.
After checking in at our front desk, you may be asked to have a seat in our waiting room. We will make every effort to be on time for your appointment. Delays sometimes occur, which we cannot prevent, and we appreciate your understanding. You may be seen by more than one clinician during your visit, including your attending doctor, physician's assistants, nurse practitioners, or registered nurses and resident physicians. During this visit, your drugs will be reviewed with you. Please bring a list of your current drugs, including doses. We will also want to know about any drug allergies you have. We welcome any questions you might have regarding your drugs. We will also ask you questions about any symptoms you might be having. Before your visit, please write down symptoms you have had, how long the symptoms last, and the time and day they happen. Please also write down what you think might have caused the symptom. You will have a detailed physical exam during this visit. You can expect to remain dressed for this exam, and there should be no pain involved. If surgery is recommended, you will be given details about what type of procedure is possible and what the risks and benefits are. We use brain models to explain your condition to you. We will also review with you any x-rays that are related to your disorder. You will be given the opportunity to ask any questions you might have. If you choose to have the recommended treatment, you will be given information about scheduling the surgery. The staff who schedule surgery will work with you to make sure everything needed is organized before your admission. You may be sent for blood tests or further x-rays before surgery. We will make the arrangements for these tests to be done and contact you either by telephone or mail with the information. You will also meet with the anesthesia team on a day prior to your surgery for a preoperative evaluation. We will contact your insurance company to get approval for all procedures in advance. If you have disability forms, we are happy to help fill them out. Please get them to your doctor's office before your surgery. We will want to communicate with any medical providers involved in your care, including any doctor, physician assistant, or nurse practitioner who has cared for you outside of Stanford Hospital and clinics. Please bring information including names and addresses for providers who we should communicate with. As a reminder, please be sure to bring the following items to your appointment: a list of current medications you are taking, a list of any known medication allergies you may have, a log of symptoms you may have been experiencing, any questions you may want to ask the doctor during the visit, contact information for doctors outside of Stanford Hospital and clinics who are caring for you, local pharmacy contact information in case prescriptions are ordered, date of most recent flu and pneumococcal vaccines if you have received them. We look forward to meeting you in our neuroscience clinic at Stanford. Our goal is to provide you with the best possible care. Welcome to Stanford Surgery Admission Unit and Operating Room. You will start your day in our preoperative area. After checking in at the surgery admission desk, you will register at Patient Access Services. Once you are registered, you will be taken to your preoperative bed, where you will be met by a registered nurse. During this time, you will be asked multiple questions about your health. You may have already been asked some of these questions, but we ask again to check that we have the right information. We do this for your safety and to make sure you are ready to go to the operating room. When these questions are done, you may ask a family member in to stay with you until you are ready to leave for surgery. As you are waiting, you will meet your anesthesia team. They will also ask you a series of questions and start your IV. This is a good time to ask them any questions you may have regarding your anesthesia. The next person you will likely meet will be your operating room nurse. She or he will ask you a few questions about your surgery and again check that you are ready to go to the operating room. The operating room nurse will stay with you throughout your surgery. You will also see your surgeon or surgical resident who will speak with you about your procedure. They will mark the correct area for surgery using a purple marking pen. They will then ask you to confirm it is the correct area and again answer any questions that you might have. Once your OR suite is ready, a team member will bring you into the room. When you arrive, you may notice what a busy place this is. This is where the rest of the OR team will be waiting for you. Your team members may include a surgical tech as well as other technicians who specialize in neurological monitoring and computer navigation. The first thing you'll be asked to do is move on to the operating table. If you cannot do this, we will assist you. Once you are safely centered on the table, you will be given warm blankets because the operating room tends to be cold. Next, the anesthesiologist will proceed by connecting you to monitors. The monitors will check important information such as blood pressure, heart rate, and your oxygen levels during surgery. There will also be compression sleeves applied to your legs. These sleeves help to keep the blood moving in your legs while you are asleep. The sensations are somewhat like a massage. After your surgical team is ready, you will be given oxygen through a mask and drugs through your IV to begin your anesthesia. You will go to sleep quickly at this point. After your surgical procedure, you will wake up in the ICU. You will likely have little or no memory of events in the operating room.
Hello, my name is Maureen Fay, and I'm the Patient Care Manager here in E2. I'd like to welcome you to E2, Stanford's Intensive Care Unit. The reason for your stay in the Intensive Care Unit, also called the ICU, is to be monitored very closely by specially trained nurses. ICU nurses take care of only 1 or 2 patients and stay in your room at all times. You will be brought to the ICU directly from the operating room or from interventional radiology after your procedure or surgery.
You may still be very sleepy when you arrive in the ICU and may not remember coming here. The nurse will connect you to several pieces of equipment for monitoring of important vital signs. You will be placed on an ECG monitor. We will place sticky wires onto your chest, which will evaluate your heart rhythm, your pulse, and your breathing. You will likely have oxygen on, either by a small tube placed slightly in your nose or by a face mask. We will measure your oxygen and breathing by putting a small probe with a red light on your finger. The compression sleeves we put on your legs in the operating room will remain on during your stay in the ICU and until you start walking. Remember, this is to prevent blood clots in your legs. You will not be allowed to get out of bed while overnight in the ICU, but there will be a catheter in your bladder that will drain your urine into a bag. This catheter will be put in during your procedure while you're asleep. You will have a very small catheter, likely an IV, usually placed in your wrist artery that will measure your blood pressure continuously. This is also put in while you're asleep during your procedure. The nurse will be able to draw blood for lab tests from this catheter without having to stick you with a needle. While in the ICU, it is important that the nurse keep your blood pressure within a certain range. This helps with your recovery. You may have continuous medications running into your vein through your IV that control your blood pressure. The nurse may adjust these medications as needed. Your blood pressure will also occasionally be checked with an arm cuff. The nurse will do ongoing evaluations of your pain level and give you pain medications as appropriate. We will try to keep you as comfortable as we can. We will use a pain scale. In spite of all of our best efforts working together to keep you comfortable, we expect that you will experience some pain. It may be hard to sleep in the ICU. It is a noisy place 24 hours a day. Some patients have nausea or vomiting after anesthesia or surgery, and we do our best to control this with medication through an IV. You will not be allowed to eat or drink during your first night in the ICU. It is safer for you to have an empty stomach in case your doctor should have to take you back to surgery unexpectedly. We will also keep the head of your bed upright during your stay to help prevent swelling in your brain. After any brain surgical procedure, the intensive care nurse will test to see if you can swallow normally by having you sip some water. This is for your safety to make sure you are able to take pills without choking. Since the purpose of intensive care is to monitor you closely, you will not be getting a lot of sleep, at least for your first night after your procedure. Every hour, the nurse will wake you up and ask you specific questions such as where you are and what your name is, and ask you to perform simple tasks like moving your arms and legs. All these tests are necessary since they tell the nurse how well your brain is recovering. There is a nurse in your room and available to you at all times. You will not need to use a call light while in the ICU. The nurse taking care of you will be happy to answer your questions or get help for you as needed. Your neurosurgery team of doctors will make rounds twice daily to examine you and will also answer any questions you may have. In addition, there may be other physician specialists helping you with your care while you are in the ICU. They will work closely with your neurosurgery team and nursing team to make sure all information is communicated. There is no set time that the doctors make rounds, but it's usually early in the morning and in the evening. If you at any time or your family has questions or concerns, someone is available to talk with you. You may also have a roommate of a different gender in your room while in the ICU. Every precaution will be taken to maintain your privacy. You will not have access to a telephone, although the nurses will establish a family spokesperson that may call to get updates about your condition at any time. We have an open visiting policy in the ICU, although we do have guidelines that we ask that your family honor. The purpose of these guidelines is to provide a setting that supports the best care for you. The ICU does not have a space to allow for family members to spend the night. However, you will be well cared for and safe since there is always a nurse at your bedside. More about these guidelines can be found in the ICU brochure, as well as other information about what you can expect during your stay here. In addition to the nurse taking care of you, there is a resource nurse who is the nurse in charge for each shift. She oversees and manages all the patient activity on the unit for that particular shift. Your neurosurgeon also has a team of residents, interns, and medical students who will be seeing you while in the ICU. There are nurse managers, respiratory therapists, dietitians, social workers, nursing assistants, and others. Our whole care team is described in the ICU brochure.
The family coordinator nurse will meet with your family sometime during your surgery or after you have arrived on E2 ICU. They will show your family around the unit, review the ICU brochure with them, ask for some history about you, and establish a spokesperson. The spokesperson will be the one who communicates with the nurses and doctors and then passes information on to the rest of the family. We ask that the spokesperson be the only one who calls for information. These practices allow staff to care for you with less confusion and interruptions. It would be helpful if you would have a discussion with your family and decide who this spokesperson will be before coming to the hospital. An ICU stay often lasts only one night. When your care team decides you are ready, you will be transferred to the hospital's G1 unit. Unfortunately, there is no set time that we can inform your family when a transfer will happen, as it just depends on when the beds become available on the next unit. We will keep you updated as much as possible about the time of your transfer. Our goal is to provide you with a safe and comfortable experience during your stay with us in the intensive care unit at Stanford as you quickly recover from your brain surgery. We look forward to the opportunity to provide the best possible care for you.
Hello, my name is Julie Tisnato and I'm the Patient Care Manager of the Neurosurgical Unit. Welcome to Stanford's Neurosurgery Inpatient Unit. Most patients on this unit are neurosurgery patients. The registered nurses usually take care of 3 to 5 patients each shift. Our goal is to give you the best care possible, and we want you to know you can always ask any of our staff questions or share concerns at any time. We hope this video will prepare you for your visit with us in the near future, and we look forward to having you here.
Within our unit are 2 close observation rooms known as NCOR. These are self-contained 3-bed rooms with a nurse or nursing assistant staying with patients at all times. The nursing staff has extra training and is available if you need care and check-in often. If you come to our unit directly from the ICU, you may be placed in the NCOR ward. It is important your healthcare team talk to one another to make sure you get the best care, so you will hear us discussing things about you at different times. When you come to our unit, we check your vital signs and do neurological checks similar to what you've been getting in ICU. We ask that your family members wait in the lounge just outside our unit while we get you settled. Most of the rooms are semi-private with only 7 private rooms on the unit. Medical reasons such as isolation have the highest priority for the private rooms, but we do keep a wish list and will try to honor any requests as best we can. Most patients having elective or routine brain surgery can expect to stay in the hospital for 3 to 4 nights, including the first night in the ICU. Family members may not spend the night at the bedside in the semi-private or NCOR rooms. We ask that you have no more than 2 visitors at a time. At each bed, there will be a telephone which can be used for local calls after dialing 9. You may also use your own cell phone on G1, but we highly recommend that valuables are kept secure or with your family. We change shifts between 6:45 and 7:15 in the morning and evening. In addition, twice daily from 8 to 9 a.m. and 8 to 9 p.m., there is a medicine pass timeout. During these times, the nurses will focus on reporting important information to the oncoming staff or delivering routine medications. We ask that you call the nurses' stations to check on your loved ones only if there is an emergency during these times. You may meet and be cared for by a number of nurses during your stay. Nursing staff make hourly rounds, but we are available at any time that you need pain medication or assistance to the bathroom. Your comfort and safety are our highest priority. There is a resource or charge nurse available 24/7 should you need any additional assistance. A short time after arriving from the ICU, we will be increasing your level of activity, diet, and switching to oral pain drugs. The catheter tube from your bladder will be removed, and we will be decreasing the IV fluids as soon as possible. You will be wearing compression sleeves to prevent blood clots in your legs until you are up and walking around regularly. We will also want you to take deep breaths or use a spirometer to exercise your lungs. All of these measures are to decrease possible problems after surgery. The nursing staff will also assist you with your hygiene, nutritional, and mobility needs. Routine neurological checks and vital signs and pain level assessments may interrupt your sleep, but it is important that you are checked on a regular basis. It is expected and normal to have some pain. We will give you medications to help with discomfort. It is best to take small naps after activity with the head of the bed elevated. Sleeping for a long time during the day may lead to changes in sleep patterns and keep you up at night. While we do our very best to make sure our unit is a quiet place, please let us know if you are having trouble resting. Planning for your return home starts as soon as you come into the hospital. We will work with you from the beginning to help with this. Many times there will be plans that will need to be put into place as well as advance of the day of discharge. We will work closely with the rehabilitation staff, physical, occupational, and speech therapists. The therapists see patients on the unit daily during the weekdays and will make further recommendations for your care, including any equipment that you may need. The physician team sees patients at least once a day. Additionally, we are able to reach on-call physicians with any immediate questions, concerns, or issues. On the day you are ready to leave, you will probably be given prescriptions for drugs to use at home. If you do not live close by, we will want to fax your prescriptions to a local pharmacy. Please let us know the name of the pharmacy where you will like your prescription sent. We will give you instructions on any drugs and when to return for the clinic visit. If you are traveling from afar for treatment here, you may be staying at a local hotel when discharged. We will give your aftercare instructions covering level of activity restrictions and when you may take a bath or shower. You are usually ready for discharge by around 11 a.m., but there may be delays in the process, so we ask for your flexibility and patience.
We are committed to providing you with the best experience possible here on the neurosurgery ward. We strive for excellence when caring for each patient's safety and comfort.
Welcome back to the Outpatient Neurosurgery Clinic. You may be seen during this visit by a registered nurse, nurse practitioner, or physician. We hope you are doing well with your recovery. During this visit, we will once again check your vital signs and do a neurological examination. In addition, your wound will be looked at to make sure it's healing well. If you have staples in your incision, they will probably be taken out during this appointment. This is not too painful, but can cause a bit of temporary discomfort. Patients often say it feels like their hair is being pulled, but the feeling lasts for only a short time. We will do our best to keep you comfortable. If you feel better lying down during this, you are welcome to do that as well. We will talk with you about all of your medicines. Please make sure to bring a list of all of your drugs. We will discuss any new symptoms you have had since you were last seen. We will also want to hear about any concerns you might have about your healing.
If you have any disability forms that still need to be filled out, you are welcome to bring them to this appointment for drop-off. We'll get them filled out and sent in as quickly as possible. During this visit, we will discuss your activity level and how this might be increased over time. We will also talk about a long-term plan for your care and give you advice for any future follow-up plans at this time. You are welcome to bring up any questions or things you would like to talk over with us during this appointment. The appointment generally lasts for about 15 to 30 minutes.